I see a fair number of women who are interested in learning about just kind of natural fertility and what happens to fertility with age, and who may be interested in fertility preservation. And then I see kind of a broad range of women and couples who are experiencing infertility in a variety of different forms and fashion, and do, everything from just plain counseling to, less invasive treatment to IVF and all of that, every fancy stuff that goes along with it. So that's kind of generally what I do. I also do a lot of work within the Jewish community. So I do a lot of lecturing and speaking and teaching in the Jewish community. I have a background in women's health and halacha, and Jewish law and how it kind of intersects. And so I have a lot of roles sort of in the Jewish community as well. And I have a real passion for all areas of education that are around kind of our fertility and the way that intersects with communities and the way that intersects with our well-being in terms of our mental health status and our physical health, and what we teach our children and what we teach other people in the community. And so that's a real passion of mine. And so I'm excited to be here.
Can I ask you a quick question that might be off topic, but that might not be? Do you have other faith-based clients, not necessarily in the Jewish community, that have similar feelings? We're going to get into the mental health aspect and, do you have other religions that also have similar issues?
For sure.
You tend to deal with?
Yeah. I mean, look, every community, whether it's faith-based or some other community, has its own sort of unique flavor and unique stressors. But certainly I see women and couples from all different types of faith-based backgrounds. So when I was in fellowship, I did my fellowship in Connecticut, where we actually saw a fair number of Catholic patients, and the Catholic Church has very strong feelings about infertility treatments, and so how you sort of navigate that and what kind of influence that has on couples and their feelings towards their faith and their feelings towards nature and their feelings towards their bodies is a really unique one. And I felt, even though sort of I come from a Jewish background, and the Jewish approach to infertility treatments in many ways is very different than the Catholic approach, sort of understanding that kind of push and pull between your faith and what the reality that you face and where they don't always align was something that I was really resonated with me and bonded with a lot of patients over, even though we were coming from completely different sort of faith-based perspectives. Certainly I've seen a fair number of Muslim patients, Indian patients, and varieties of different kind of cultural influences, even women and couples who are not in a faith community but have strong cultural sensitivities of one kind or another. There's a lot of parallels that you can draw.
Interesting.
Yeah.
I would love to hear more about that at a different time. That's
one of the back in the day when I did lectures in person and got invited to synagogues as scholar in residence, we had groups of people together. One of the lectures that I often give or talk about is sort of the status of embryos in science and religion, and it ends up being sort of a kind of a comparative religion approach to the views of the human embryo. And
I wonder if everybody on here right now would rather hear that than
that's very different. A different Instagram live.
Yeah. I mean, that's more.
It's like ethical, and it's really fast. It's kind of dense. It's like a little dense, but it's fun. I like it.
Okay, so let's talk about our topic, which is so in general, your clients or patients, I guess, would be. I mean, there's mental health implications. Obviously infertility is not a mental health issue, but there can be mental health implications going through the treatment. So can you just kind of describe the experience in general, and then maybe we could go into how extra challenging it is now?
Yeah, absolutely. So I think to break it down, let's start with a couple who's experiencing infertility. there are many kind of intersections with mental health. And I'm not a mental health professional. I'll put that out there, but I work very closely with many mental health professionals, and I often am referring patients to mental health professionals, or kind of provide that first line of support, when patients are either resistant or not quite ready to seek mental health help, assistance from a mental health professional. So I will start with that, but I do feel like I have a lot of experience in this. And so, at the beginning, when someone's experiencing infertility, and maybe even before they ever see a fertility specialist, the first it's an emotional roller coaster, even for, somebody who doesn't have a previous mental health history. There's really this emotional roller coaster that comes along with trying to have a baby when it's not kind of going the way you expect it to be, and kind of this up and down of like, getting your hopes up and then having them be, then being disappointed, and up and down and up and down. And then as you become more sensitive to it, seeing other people around you and perceiving that they're having an easier time. So that the women and men who come to my office for care for infertility have already lived that life for some time, meaning typically they're coming to me having tried to conceive for at least a year. Sometimes it's less, sometimes it's more. They're already living in the space of something is wrong with me, something is wrong. There's a little bit of desperation that's starting to set in. And so I'm already seeing them at that stage. And it's we're talking about sort of a basic human function that everyone takes for granted. No one ever grows up thinking they're going to have trouble conceiving. And it's, despite the fact that we kind of talk about it as being common, nobody really wants to internalize the fact that they may be the one who's experiencing an issue. And so you get this kind of sense of, nature or my body or the world has sort of disappointed me, or I've let them down. People take it in different ways. There's a lot of guilt, there's a lot of shame, a lot of frustration and disappointment. And so that sets the stage for, before you even start any treatment, you're setting the stage for somebody who's having a stressful emotional platform. And, everybody has different coping mechanisms, and some coping mechanisms are healthier than others. But you're talking about something that's already been going on for a long time, right? So by the time they come to see me, this has already been percolating in their head for at least a few months. And that's always a setup, for difficulty, meaning even the people who are the best at coping with stressful situations, the longer it goes on, the harder it is to cope with those things. And then they come to see me, and, I start from square one, and I say, okay, we're going to do all these tests. We're going to try and figure out what's wrong. And sometimes we come up with a very clear reason of, why they've been experiencing infertility. And often we don't come up with a clear reason, right? So 30% of infertility cases are going to be what we call unexplained infertility, right? Where there's no clear diagnosis. That's extraordinarily frustrating, right? Even just the diagnostic of it. Like, I'm telling you, I don't have a good reason. And often when I speak to my patients who have unexplained infertility, I tell them that I kind of hate the word unexplained. But what it means is that it's not that there's no reason. It's not that there's nothing wrong. There's clearly something wrong, or you would never be sitting in my office, right? Something's going on. We just don't have the test to find it. The good news is that we have good treatment that works for it. So infertility treatment generally, and thankfully, have become so much more successful than they've ever been before. To the point where the vast majority of couples are going to conceive one way or another. And it's just a matter of finding the right path. But some of that is a little bit of trial and error, or, we start sort of at the lowest, least aggressive, least invasive, least expensive, and we move up. And most of the time, these are couples who were, ready to conceive a year ago. So that is a frustrating process. The actual treatments themselves can be time consuming. So I tell people it's like having a second job, right? You have to come in for monitoring. Sometimes you're coming in daily or every other day. Sometimes there's injections and medications, and there's obviously hormones that get involved, and hormonal fluctuations set the stage for other kinds of emotional responses. And this is like sort of the most personal, most basic, most intimate thing that a couple or a person could go through, and you're medicalizing it and making it a stressful, time-consuming, labor-intensive, logistical experience. So there's
I've actually heard that from friends that they kind of like that their intimate relationships with their spouses kind of are jeopardized because they're trying to just be functional about it, and that's really tough on the mental on the health of their marriage. And
for sure. I mean, there's so many just like well-being issues that come up that me as the fertility specialist, I almost have to ignore because I just don't have the capacity to address all of those things, right? So like my primary goal is to get the baby, and sometimes it's, you know, at the sacrifice of some of these other well-being issues. And, you know, thankfully, most of the time, this is a temporary circumstance. And, you know, it's kind of like you put your head down and you grin and bear it. And you know, when you're done, you can sort of process and digest everything that's going on. But, you know, often it's prolonged. Often there are almost always surprises and, you know, bumps in the road. And that can be really challenging in so many ways, and it manifests itself in many ways. So I have, you know, patients who, like you said, like sometimes it's the, you know, physical, intimate relationship that suffers. Sometimes it's a relationship with a friend that suffers, or with a parent, or, you know, work that suffers, or there's so many, eating, sleeping, you know, so many functionality that can suffer, especially because many of the couples or women who are going through this are private about it, meaning it's not that everybody who's around them knows that this is what they're doing. Maybe they've spoken about it, maybe they're open about their diagnosis, but it's rare that someone's going to have a lot of really day-to-day minute support through the process. It's really just the couple going through it together. And like,
and isolating, and
yeah, it's isolating. And, you know, just to give like an example, let's say to tie it into what we're talking, you know, to how some of the things we're experiencing now, right? So, you know, you take a family where, you know, parents are working, there's children, they have school, and there's like a million things going on trying to like organize who's going where. Some of my couples who are doing infertility treatments, it's a similar sort of phenomenon, right? You have to like get to the office by 7 a.m. to do your blood work, to do this, got to get to the, you know, then you have to go to your work. You have to figure out if you have kids, you have to figure out who's going to watch those kids. Husbands and wives are splitting up and you know, there's a lot of logistics, just maneuvering. And that's not something as a doctor I can help with, right? That's something that the couple has to figure out how to set up together. And so, like I said, coping strategies, and everyone has their breaking point, and everyone has, you know, some couples are cope better than others. And it's just everyone's feeling stressed. There's no one that breezes through infertility treatments without some sort of emotional stressor. It's just not possible.
That's interesting. Like you've never I guess it's a very stressful thing.
Yeah, I've never had anyone who was like, that was a breeze, right? It can't be, right? You're being, when I have a couple, and the truth is, the same is true for the single women I see who come to me for egg freezing. That person or couple who's sitting in front of me in my office, that was never plan A, right? Nobody ever like planned their life that they were going to have infertility treatments, or they were going to have to freeze their eggs, right? And so I recognize that the minute somebody's walking into my office, they're coming to me from a place of vulnerability, a place of like, this is not how I expected my life to be or to go. And they have to, and we as a team sort of have to reconcile that and deal with that. And that, you know, there's nobody, it's just not possible to go through it without sort of having some of that, you know, kind of emotional distress. Now, they're varying degrees, obviously, but
and then now add a worldwide pandemic to the mix.
Yes, that's not, you know, that's certainly not helping. And I think that's part of, you know, what made how this all unfolded so challenging is you're already taking a group that's kind of emotionally vulnerable and saying, everything you've been working on and everything we've been waiting for, we're just going to stop. And I think that was really challenging. It was challenging as a physician because my whole life's work is helping people, and to have to like pause that was a kind of a really weird place to be. And it's challenging for patients because it's there's so much tunnel vision. There's so much focus on this one thing that you've been working for so long. To then just kind of unceremoniously stop that is just, it's like very jarring. Even for couples who really truly understood and felt that it was the right thing to do, it's still like, it's not, nobody's happy about that.
No, there's a lot of unknown at
so much unknown. I mean, there still is. So now that in New York, now that, you know, the peak has, thank God for the time being, passed, and most infertility clinics in New York have resumed treatment in some way. Typically slowly, we have all sorts of precautions, but there's still so much we don't know. We don't really know what impact COVID could have on pregnancy, what impact it could have on babies. Like, we don't think that there's a significant increase in birth defects like there was with Zika virus, for example. Like, that was very clear. All of a sudden, there were unfortunately, all these babies born with birth defects. So we're not seeing that, but subtly, we don't really know. Does it have an increase on miscarriages, preterm labor, you know, stillbirths, pregnancy complications? What happens when moms get sick? They have to deliver their babies. Or like, there's so many variables, so many things. But, you know, it's hard to know. Do we stop the whole world? Do we stop people? When there is no major organization that's telling couples not to try to conceive right now. So we have a very, you know, lengthy counseling conversation and a lengthy new consent form that talks about all of these unknowns. But we're taking, you know, some steps forward. So now you're adding all of this additional, like, anxiety and concerns. So, and some of those anxieties and concerns are going to be true for couples who are trying to conceive without the help of infertility treatments, right? There's just so much we don't know right now. But that stress is sort of all the more there for couples who are experiencing infertility. And also there's just that constant feeling that time is running out. And that goes into the whole, like, what happens to women, you know, female fertility as we get older, and, you know, is there going to be a real significant change because you waited a few months? Generally, we don't think so. And you know, this is what I've been telling my patients, is that a short pause on treatment has never really been shown to jeopardize somebody's outcomes.
But I mean, you can freeze eggs.
Sure. I mean, we do that all the time. We freeze eggs, we're freezing embryos. So I have couples who were who were planning to do IVF, who are nervous about getting pregnant right now, but are freezing their embryos so that they at least made embryos. They know they have healthy embryos. They're having them tested, and then they're waiting till they have a better picture of what's going on. I have some couples who are choosing to do that.
So when you talk about sort of like mental health education within the context of what you do,
mm-hmm.
So what would the process be with, like, kind of coaching them through?
Yeah, so we have, and every practice is going to do this, you know, is going to be set up differently, and every doctor is going to have kind of a different style. We have kind of, we call them fertility advisors or IVF coordinators. And they're kind of I don't know if concierge is the right word, but like the person who really sort of holds somebody's hand and step-by-step walks them through the process. They are, you know, the first line if somebody has a question that's not medical, right? Like, I can't get through the pharmacy, or I don't know if this is the right dose, or whatever, you know, any question that's not a medical question. They're kind of the first line, where they are super knowledgeable, very helpful, and will help walk people through that process. So just knowing that there's somebody they can call or email who can help them with a question helps, you know, bring some of that anxiety level down. Remember, I told you there's so many logistical pieces here.
Mm-hmm.
Like a lot of moving parts, and, you know, dialing up medication doses, and even each individual thing seems small, but you add them up and you're putting them in a generally stressful environment, and it's hard. So knowing that there's somebody you can do that for is very helpful. And so we're having this kind of constant communication with our patients. And so it is a little easier when you're doing that to pick up on the couples or women who need extra help and need extra support. And sometimes they'll reach out to me directly, and lots of my patients either, have an email address that I, communicate with them if I think it's really important, or I'll call. I always try to call and check on my patients. So I try to keep that line of communication open. And if needed, like I'll often will suggest, do you think it might be helpful to speak to somebody? I have like a list of names usually, and I've had, people who I've worked with in the past. Often when I suggest that to people, to couples or to women, they're like, yes, please. They feel relieved to say, oh, someone recognizes that I'm really struggling here. And it's normal. It's meaning it's so common for couples or women or men to need support during this time. It's just,
is there support out there for men as much as there is for women?
Unfortunately, I don't think there is as much for men as there are for women. I think my experience is that men are less likely to seek support. They're less likely to really verbalize the stress that they're feeling. But it's out there, and I think there are men who take advantage of it and who really benefit from it. And support can have different things to different people. So we talked about this when we were talking earlier. So there's like public support options. So there are organizations both within faith communities and in the Jewish community, and then just generally there are organizations that have, chat rooms and resources and group sessions and chat boards and you can ask this, ask a patient, ask a psychologist, ask a doctor. There are programs where you can get paired up with somebody else who's been through treatment in the past, like kind of a big sister, little sister type thing. We do that sometimes with egg freezing. We have a program where somebody wants to get paired up with someone who's already done it. We do that for them. And then there's, individual support, therapists, psychologists, psychiatrists, right? Sometimes people need medication the same way someone may need medication for postpartum depression, and it's a short kind of concrete period of time. Doesn't necessarily mean they're going to be on medication for long term. Or maybe this is the spark that kind of got them the help they needed and the medication that they needed. So all of those things, I think, to demystify it and destigmatize it and bring it up and say, look, I have lots of patients who need this support. And I do, it's true. I think gives people, opens up and gives people the space and the permission to take the support they need.
What would you say that we could do as a community to help support the destigmatization and the to help kind of stop that, like the shame cycles? And I know that there's a lot of, like, even though people know that there are other people going through it, I think that there still is shame, even though there's nothing to be ashamed of.
Yeah.
So how would you tell the community that they could support those who are suffering? Because often you wouldn't know even. So
yeah, and I think it's real. It's a real challenge. There are some organizations that are doing a really good job, that are making real strides in destigmatizing infertility in the Jewish community or in the communities at large. But it's still at its heart a private thing, an intimate thing. That is hard for people to share, right? When someone has a baby, it's public. Everybody knows that there was a baby coming, then, they get meal trains and they get, phone calls and everyone's checking in on them. And, that woman or that couple is sort of expected to have a certain kind of process that happens after that baby is born, right? When somebody is diagnosed with infertility, it's equally as disruptive to their daily life And yet nobody really recognizes that disruption, right? When a baby's born, we recognize how disruptive that's going to be to the life that they had beforehand.
Yeah.
But with infertility, we don't. And I don't know what the right answer is. Like, I don't know how we can get to a point where that disruption is recognized in a sensitive and not intrusive way, right? So on a broad scale, I don't know. I think on a more individual scale, reaching out, if you're a person that somebody's opened up to, that they have experienced infertility or are experiencing infertility, kind of understanding what that means. And this is where some of those communal approaches may be helpful, right? Like, I've given talks in communities where the topic is basically explain what somebody who's going through infertility, what that experience is like, so that we can be supportive to our friends and our neighbors when we find out that they're going through infertility. We can understand what that stress is like. And so if you're the individual that someone's opened up to know, okay, what is it like? What are ways that I can step in and help this person? Do they just need a listening ear? And sometimes they do, or do they need someone to help, pick up their kid or watch, whatever it may be. Even like I said, there's so many logistic pieces that get overlooked about how just labor intensive and infertility treatment is, that if you have a friend who's able to help kind of offset some of that, or run interference when you go to a wedding and somebody, people say crazy mean things and they don't realize, right?
Well, because like people get bloated when they're going through treatments, right? And then people, like I had a few friends who were going through fertility treatments, and people asked when they were expecting, and they just had to leave. It's horrible. It's
terrible. It's just, look, I think it's going to be a while before we can teach people to keep their mouths shut and not say insensitive things. Like, there's going to have to be just a generation of people who just grow up learning not to say things like that. But yeah, if you have a friend who can run interference, who can be sensitive to, like, this is going to be a really challenging emotional situation, right? Or you have a family member, you go to, a holiday dinner, you're at the Pesach Seder, and somebody, it's just like, there are so many little things that kind of like mini triggers that if there's somebody, if you're the person that somebody's confiding in, just to help run interference so that they're not the only ones feeling it, right? And being sensitive to, wow, that's actually something that would be very painful for this person to hear, I think is very helpful. And that's where, from a community standpoint, having communal talks about what it means to be, for a couple to experience infertility in the Jewish community or in any community, can be helpful.
I think I wouldn't say in particular the Jewish community, but in particular communities that are centered around, like, I think we discussed this before, around family life, and the Seder is it's about teaching your children, and it's devastating if you go to the Seder and you don't have your own children, or like if everybody else is around you has children and you don't, like, that's a very painful experience, whether you're like in the comfort of your family or not.
No, and like many times when I talk to patients and friends or anyone, it's okay to bow out of certain like events. Now, it's hard to get out of Pesach Seder with your family, but you don't have to go to every baby shower, and you don't have to go to every birthday, and you don't have to go to every bris, and you don't have to be kvater at every bris. So that's, people who get asked to do that. There's just, you can step away from that, and you can protect yourself in that way. And then, if there are others in the community who can be sensitive to that and not push back, and they're like, oh, okay, so example, like, I think the kvater thing is a great example. So kvater is like the tradition, for those who may not know, where the baby at a bris gets carried in, and again, this is when we had brises in shuls with some people, but the baby gets carried in, and traditionally the couple, somebody has to pass the baby from the women's section to the men's section, and traditionally that honor was given to a childless couple. as like a special merit that they should merit children. So it's a beautiful idea, and comes from a good place. But if you're somebody who's been struggling with infertility, you're like the person that all your friends are going to ask to be vater. And like after a few times, it gets old. And if you want to step back, or you can have someone who can do that for you, or, or people who are sensitive to, if this is not something you want to do, it's totally fine, rather than being, pushy about it. Those are small ways in which the community can become more sensitive. But on a whole, it's hard in family-based communities. That's not changing. That the family structure of the Jewish community, or one of these, or any other community where the nuclear family is such a central role, like that's not changing anytime soon. And so it's more about being open and sensitive to that there are others who don't fit that mold. And it doesn't have to be someone who's infertile. It can be like a widow or a widower or a divorcee, or, there's just so many now families that don't fit the kind of typical model.
Yeah. I mean, it's so common that today more than ever that the family isn't the same family structure that it used to be. So I guess that's one step forward for people feeling like they belong. Because it's silly that we can't go out of our way to be inclusive in community events and make sure that everybody feels like they're a part of it.
Yeah. I mean, it's hard. I think it's, first of all, so many traditional, so many traditions are just kind of family based. And you want to be inclusive in a way that's not like patronizing. And I don't know.
But are they really? I mean, I know that's also getting off topic, but I feel like a lot of the traditions that we do today are influenced by more modern, like they're not really our traditions.
I think that's true. I mean, I'll tell you, for example, we keep talking about the Pesach Seder, because I think that's just an example of when like everybody gets together and can be pretty like stressful and triggering. So this year, most of us, I think, did very minimal Pesach Seder, right? This is the first time in my life that I didn't do like a giant Pesach Seder with my entire extended family. It was just like my husband and I and our kids. And it actually was so like liberating.
Mm-hmm.
And I imagine, I can imagine, let's say if it was just me and my husband and we didn't have kids, like that would be very challenging to have a Pesach Seder, just the two of us, but also in a way, a unique, meaningful experience. The same way, like my kids had a unique, meaningful experience that was different than we would have typically had with our families. But we'd never get away with doing that outside of this kind of situation, right? So,
well, but maybe the tides are shifting.
Right. So opening up some of those flexibility, right? To being like, it's okay if you want to have a Pesach Seder, just the two of you, or you want to, I don't know. I mean, that's obviously.
I actually wrote a blog about, it was I think it was either when this whole COVID thing started. And I think it was around Purim time. It might have been like about Purim, but I tied it in to my Pesach experience about 14 years ago when my son was in the NICU for 10 days over Pesach. So he was born 2 days before Pesach. It was touch and go. It was very scary. I had 2 older kids, and I felt like I was abandoning my older kids. Like I felt like it's so much shame around like not being there for my big kids, my older kids, at the Seder, and not like I'm kind of like ruining their Pesach experience. And then I don't know, like I just remember like such mixed emotions. And then as it turned out, so we had a couple that we were very close with at the time that were in medical school, and it was just the 2 of them. And so my husband stayed home with the kids and did a Seder at home. And then this couple came and did the first Seder with me. And then the second night, one of my single friends came and did the Seder with me. And I think it was, and you know, when we went to go visit my son in the NICU afterwards, and I got to be in my pajamas, and you know, and I actually found that it was such a meaningful experience, even though it was one of the most painful times of my life. It was very, very meaningful.
Yeah, I think that we may find a variety of positives that come out of this experience. And one of them may be, and look, I don't know, I'm no expert, but one of them may be kind of the breakdown of like what are long-standing norms of how Judaism has to be practiced, right?
Mm-hmm.
Minyan 3 times a day. You know, this has to be done this way, and this has to be, it's all because it's always been done that way. And here, like, the whole thing got uprooted, and now it's like, okay, well, what parts of it are we bringing back, and what parts of it are we going to actually embrace some of that flexibility? And I think, like you mentioned, I think that could be very empowering and opening, you know, like a big boon for inclusivity, not just for, you know, not just for infertile couples, for all sorts of people going through all sorts of different things that don't kind of fit into the classic mold. You know, the same way when someone's experiencing like a long-standing illness or a life-threatening illness, right? We give them all sorts of, we make all sorts of exceptions, and I'm not only talking about exceptions with the like rules of how you practice, but just like there's more leeway given and more sensitivity and understand, like, oh, you didn't make it to the Shabbos meal, like, oh, I get it, you got a lot going on, what can I do to help? Whereas a couple with infertility, because it's so private, they don't always get that. What?
There might be more judgment, you're saying?
Yeah, they don't always get that leeway, and or they don't know if they're getting that leeway, so then they feel guilty or they feel judged, or it's just, it's hard. I think this is not going to get solved overnight, obviously, but it's interesting. I think that's one of the ways in which maybe communities will become more fluid and more, there'll be just sort of a more flexible approach to how to practice. That could be very helpful for all sorts of people.
And I do see, not just related to infertility, but I do see that a lot of people are more comfortable with expressing their uncertainty and not being okay, and that admitting that they are struggling. And I've never, ever heard it being spoken about so openly. And I think that that's a huge step forward for, you know, breaking the stigma and kind of breaking that shame cycle.
For sure. I mean, there's this notion of like the infertility warrior. We talked about this earlier. And I think the same way we're seeing people talk about, you know, their struggles parenting during this, you know, during coronavirus, or keeping relationships with their families, or the loneliness, you know, the isolation. We're now allowing ourselves as a community, not just a Jewish community, as a humanity, to be open about that, to say, yeah, it's okay that we're not okay, that this is a crazy situation beyond our control, and we're just dealing with it the best we can, and everybody's going to deal with it differently, right? There's no right or wrong way to deal with this. And we've as a community and as kind of humankind have been accepting of that. And those are many of the same thought processes and emotions that happen when someone is given a diagnosis of infertility or is undergoing infertility treatment. It's the same disruption to their daily life, upending of sort of the natural order of the way they expected things to go, and being able to say, like, this is completely out of my control. I don't know how I'm going to deal with this, or I'm dealing with it the best I can, and I'm not always okay. And being able to be open about that is actually going to be very liberating for people. I think people will feel more comfortable not having to put on the happy face of like, everything is fine, it's going to be great, I'm fighting. And it gives people the room and the space to say, like, sometimes it's just really, really hard, and I don't know what to do. And so I think, most people, actually everyone, has more strength and more resolution and fortitude than they think they do. But it's just, everybody experiences it differently. And so if you don't feel very much like a warrior, like, that's okay. And I think we're giving people, one of the things we're learning from the whole coronavirus situation is that we can be accepting of people not being okay.
Yeah. And we don't have to pretend that we're,
and we don't have to fix it. We don't have to try to fix it, right? Because we know we can't fix, this is so big and so sort of beyond us that nobody's trying to fix it. You're just like, yeah, I get it. It sucks. Hopefully it's going to be better soon. And so I think that there's a training process that's helping, that may really help communities, help other couples and who are going through all sorts of things.
That's real. I think that's really a powerful message of, and it kind of brings a lot of hope to people, just acceptance that it's not within our control, and just.
Yeah. I mean, I think it's, and I often tell, conversations I have with patients when things don't go the right way, or we're at a fork in the road about, should we do this treatment or should we do this treatment? And, can we go, and I'll go through the science and the evidence and my experience and what are my recommendations. But ultimately, I tell people, you have to feel whole with the process, right? You have to feel like this is you going through the process, and that you understand and feel comfortable with the choices that you make. And even if you get to the point where that choice is that you're no longer pursuing treatment, you have to be whole with that process. It's not something that someone can foist upon you, right? So it's not something you can say I refuse to treat you, right? It has to really be a situation where we come to some kind of discussion where you can feel like that you owned this process, for good or for bad. I think part of that's what was so painful about the stoppage for coronavirus, is that you can't own that process. It just happened.
The choice is just taken away.
Yeah, I really do encourage my patients to own their process, even when so much of it is out of their control and we can't know the outcome. To know that you made the best decision you could with the best information that you had, and you moved on to whatever that may be, because you made, you were taking the time to think it through, is very helpful for people.
I have one more question, I think. And so would you recommend that anybody who's going through, I know you said earlier that it's a struggle for everybody, it's a mental health struggle for anybody that's undergoing infertility, because it is a very, uncertain and, emotional process. If somebody isn't exhibiting symptoms of mental health concern, would you still recommend that they get support anyways?
I think it's hard. I think people are very taxed. It's a taxing time, right? So asking somebody to do another thing can have the opposite effect. So for example, there was a study that looked at women who did acupuncture for IVF. And ultimately what it showed was, when the acupuncture became more stressful, like a stressful event that they had to get to their acupuncture appointment and they had to, all of those things, that actually had a negative impact on the whole cycle. So I use that as an example of this is a taxing process, and for somebody that stress is influencing their daily life, like their functionality, that's someone who needs the support to help them get through the process. If speaking to a therapist or some of these resources are going to have the opposite effect in that, in that acute period of time, then it's not something I like to push on my patients. But I always like people to know that what's out there, because just like there are seasons in life, there are seasons in this process. And you know, how you feel one week can be completely different than how you feel the next week. Nobody knows how long this process is going to go on, right? They could be somebody gets pregnant in their first cycle, or it could take 6 cycles or 12, you know, whatever it may be. We don't know what the end is going to be. And so knowing that those resources are out there is important, because you want to be able to either send somebody, direct them to that, or have them reach out when the time comes that they really need it and it is useful. There are clinics that have support staff, like professional support, mental health support staff in-house. You have to have the volume to really make that worthwhile. But it is nice to have that, you know, like, and I think that may be something that people move towards in the future, but for the time being, I like to make sure people know what's available, and then, you know, keep those lines of communications open, because it really can, we're putting so much on people's plates, and it really can be a burden. So I want to make sure that it's going to be, the support's going to actually do the job that it's supposed to.
That makes a lot of sense. Thank you.
You're very welcome. Thank you so much for having me.
Thank you so much. I really think that if nothing else, the take home should be, for, like, I don't like the word should, that I hope that the take home for everybody is kind of just to be able to put themselves in other people's place and recognize that a lot is going on behind closed doors that people don't really know about, and that, you know, being aware of possible struggles that people are having in order to be extra sensitive and supportive is, I think that's a really important take home, because I really never thought about it the way that you said it. But I really think that, and I do have friends who have gone through infertility and secondary infertility, and it seems like a living hell. But you know, I think you kind of gave a really great insight into kind of the life of the suffering and how involved it is, and we should all kind of be more in tune with.
Yeah, I mean, I think everybody's struggling with something.
Yeah.
And so just sort of generally being sensitive to, like, what you see on the surface is probably not even close to what's really going on in somebody's life. And, you know, the vast infertility treatment is stressful, and, you know, there's a lot going on, and there's a lot of uncertainty, but in the end, most people, it's not insurmountable for most people, right? For almost everybody. And the treatment itself is so overwhelming and intimidating. And yet when women actually, and couples, get in the weeds of it, they do it. Right. And are able to. So again, it's the balance of recognizing how challenging it is without it being, you know, sort of overly making it intimidating beyond what it needed to be. But really just recognizing, you know, that everybody's going through something, and that we don't all fit in the molds that we think we do or we want to. And again, like, if you're the person who gets to be the, you know, opened up to, you know, to just sort of find sometimes practical ways are the best ways in which you can help somebody.
That makes sense. But I was talking to a friend recently, and she said she was really down just because she felt like she was the only one that she knows that's suffering. And I said, that's impossible. Everybody's suffering. But you might hang out with people who know how to fake it better than you do. Like, everybody is going through stuff, especially now. And
now.
You never know what is going on behind closed doors. So yeah.
All right.
Thank you so much.
Thank you again for having me.
May a great week.
Thank you. You too. Be well. Be safe.
You too. All right. Bye.
Bye-bye.